Hi everyone, welcome back to Mummy Matters. Today's episode is with a GP that specializes in women's health. She has an in-depth knowledge on contraceptives and is here to bust all the myths, as well as give us a comprehensive overview. I have personally known her for around 8.5 years, and it's my honor to be introducing you to the very talented Dr. Sonia Rai.
So my name's Dr. Sonia Rai. I've been a GP for about 10 years now in Leicestershire area. I've been doing coils and implants and contraceptions for about 8 years, which I love doing, and that's what we're here to talk about today. Also, I'm a mum of two, so I've got a 9-year-old and a 7-year-old. So I understand the kind of struggles of mixing and, how important it is to look after yourself, and we don't always do that. So hopefully we'll have a good chat about all the contraceptions.
Yeah. So let's start with what are contraceptions and what do they help with?
Yeah, so going back to really basic kind of level. So basically, a contraception is a type of method that's going to stop you from getting pregnant. So there's actually lots of different types of contraceptions. When I was writing it down the other day, I think I wrote 15 different types of methods. So everyone thinks of contraception, they might think of a pill, but actually there's loads. So you've got like your natural methods, you've got things like caps, diaphragms, condoms, injections, pills, permanent methods as well that we could touch on as well. I mean, the great thing about England, the UK, is that we have our NHS, our fab NHS, and contraception is free. So all forms of contraception that we have are free, including condoms. So if you went to a sexual health clinic, you can pick up free condoms from there. So we're really lucky that we have this. And actually, we're probably one of the worst countries to utilize contraception in Europe. So, and I don't know why, because it's free and people know about it, but it's just one of those things, I think. Yeah. So promoting it is really important.
Yeah. So as a mom, which are the most popular types that people use and what has the most success rates?
Right. So initially, when we go on contraception and we're younger, our needs are different. So every time we look at somebody, it's a tailored approach. So I would never say, oh, you're a mum, this is your best type of contraception. It depends on you, your lifestyle, your health beliefs and things like that. So you've got to tailor it to everyone. So initially, if you were like 15, 16 and wanted to start contraception, we might say to you to go on the pill. Lots of people know about the pill. It's been around for years. It's something, and it's about 70 to 99% effective, depending on how well you take it. So a lot of people use it, you take it every day, you have your break, you have your period, and that's how you take it. Now, actually, you can do tailored regimes. So if you wanted to go on the pill, for example, but you didn't want a period, there are types of pills that you can take continuously and you don't have a period with it at all. But the only thing about pills is that it's very user dependent. So that means it relies on the person to take it every day. This is why there's such a range of how effective it is. So before, if you're only having to worry about yourself, you remember to take your pills, you take your vitamins, you take everything. As soon as you become a mum, you forget, and that's why the pill is not a great option if you've just had a baby and you're busy, because you're more likely to forget it. And if you forget it, then there's a chance you can get pregnant. Right. So when women come, and every woman will have the chance to talk about contraception when they come in for their 8-week baby check. Okay. So the baby check is for the baby and also for the mum. And one of the key things is to talk about contraception, we talk about things called LARCs, which stand for long-acting reversible contraceptions. And the good thing about that is they're not dependent on someone taking a tablet. So once they're in for 3 to 5 to even 10 years, and then you don't have to worry about your contraception again. So if you asking as a mother what the best type of contraception would be, I would say go for a LARC option.
Okay. And what's the success rate?
So it depends again, which one. Okay. Actually, all the LARCs have really good success rates in terms of the evidence shows that they're 99% effective. So if you've got a LARC in your body, you're not going to get pregnant. So that's the kind of take-home message. So that's why they're different from the pill, because, once only, you don't need to worry about it. It doesn't matter. With the pill, if you get ill, it can sometimes not work. If you're on antibiotics, it can sometimes not work. So there's lots of things that can affect it. But as long as everything is like in terms of your health, your past medical history, your drugs that you're on, if everything is okay, then you could go for a LARC option. So the first one, so we can move on to the LARCs now, actually, is the Depo injection. Okay. That's kind of your progesterone hormones. You've got two hormones in your body, your estrogen and your progesterone, and the pills have got a combination of both or just one. So the Depo is a one that goes in the arm, normally in the top of the arm or in your buttock, and it lasts 12 weeks. And that one is good because for 12 weeks then you're sorted. Again, if you're a busy mom, coming in every 12 weeks to the surgery can sometimes be quite difficult. So if you don't book that follow-up, you're going to lose the contraceptive effect. So after 3 months, you're not going to have it. So not many moms actually go for that option. The other options are the implant or the coil. Okay. So the implant is, again, progesterone hormone, and it's a flexible tube that goes in the upper part of your arm. So we normally put it like here in the arm. Okay. And it's like a little injection, and it numbs the area, and it just goes underneath the skin, and you can normally feel it, but you can't see it. And that's great because it's not painful. It's a little injection that numbs the skin. It lasts for 3 years. And with that one, it can stop your periods as well. So sometimes that's a good thing. Sometimes women like to have periods. So that's why it's not always a good option for everybody. The only downfall of that option is it can give you irregular bleeding. So if you like to know when your period's going to be, that sometimes that can be an issue because especially the first 6 months, you can get this irregular bleeding pattern. But that's a great one because once it's in your arm, 3 years, you're done, especially if it's your first child. And if you want to have more children in the future, after about 2 years, you could decide to take it out. Your fertility goes back to what it was before. And that's it, you're done. If you want to carry on, you can just take it out, put a new one in. So that's a good option too. Do you have many friends with implants?
I've got a few. But yeah, it's for the same reason that once it comes out, I think you get the fertility back. And I think that's a big thing for the moms that I know, because they've got that option. They're not strange.
Yeah, and out of the two options, out of implant and coil, is definitely the least painful. So if you're going to say, oh, I want something that's not very painful, then implant's probably less painful.
Right.
So yeah. Okay. So that's your implant. So then you've got your other type of LARCs, which are your coils. And there's two types of coils, and not many people know this. Everyone assumes that coils are hormonal. They're not. So you've got your non-hormonal coil, which is your copper coil, and then you've got your hormonal coils, which is the Mirena coil, which many people know about. And there's actually another one called the Coil coil, which is the same, but it's actually got less hormone in it. So the one that people mostly go for is the Mirena because it stops your period. So, and that lasts for 5 years. So that goes internally into the womb. And the way that's done is, so most women have had a smear test. Mm-hmm. So it's like having a smear, that kind of position. You use a speculum. And then the entrance to the womb is called your cervix, which is where we normally take the smear from. And then you pass the instrument through and it sits into your womb. It's actually a very small instrument. It's probably the size of my fingertip. And when that goes through, that can cause like cramping pain and discomfort. But most people will use like numbing gels and things like that to help with that. Nice. So if you can tolerate a smear, you can probably tolerate a coil, which is what I normally say to women. So and that one is good because it makes the lining of the womb very thin. You don't get a period with it. You might get some light bleeding, you may not. And again, it's long term, it's 5 years. And if you take that out after 3 years, your fertility's back to how it was. The Coil is exactly the same, it's just a little bit smaller. But that one, because it's got less hormone in it, you do tend to get a period with that. So if you want to have a period, and a lot of women do want to have a period for cultural reasons or personal reasons, that's not a bad option because you'll get a light period every month. Now, if you didn't want to have any hormones in my, if you said, look, I don't like hormones, I don't like the way they make me feel, then an option is a copper coil. So that's purely, it's actually like a coil, but it's got copper in it, and that stops the implantation and the sperm reaching the egg. So the only downfall with that one, though, is that your periods will become heavier. So if you have heavy periods, I tend to tell my ladies, don't go for that option, because they get really heavy periods with that, and that makes them anemic. So, but if you have very light periods and you wanted to go for an option with no hormones in it, a copper coil is great, and they can last 10 years. So if you're in your 30s or 40s, that's 10 years of contraception sorted for you. So they're the main ones that I would offer somebody that's coming in like at their 6-week check.
Okay. So going on from that, what are the short-term effects, side effects, and are there any long-term effects? Because it is obviously a foreign object going into your body, right?
Yeah. So with any procedure, you've got a risk of infection, bruising, bleeding.
Yeah.
The infection, actually, with all coils in this country, we swab all our women for infection.
Yeah.
It doesn't cause infection. So some women think that if you have a coil and it will give you an infection, it doesn't give you an infection. But if you do get an infection, then we can give you some antibiotics, and that will be picked up on the swab that we do when you're having your coil done.
Right.
There is a risk of infection putting it in because it's an instrument, but it's done in a sterile procedure. I've been doing it for 8-9 years now. I've never had an infection after putting a coil in. The other side effect is that it can be expelled. So sometimes some women in the first 6 weeks, it can actually come out, the coil. And if that happens, and obviously your body's rejected it, so it's not going to work. So normally what we do is we do a 6-week coil check, or we get the ladies to check their strings, and we show you how to do that to make sure it's in place. Obviously the procedures it can be painful. You can get some cramping afterwards. Mm-hmm. It's like a period cramp which lasts for a couple of days maximum, and then it just settles really, and then you might get the irregular bleeding at the beginning, but most women it will settle into a pattern or just stop completely, right, like within a few weeks.
So you have to be patient with it.
Yeah. And I always say to my ladies, like, give it at least 3, especially for the implant and the coil, give it at least 3 months for it to really settle into a pattern. Because, if you can persevere for that first bit, you've got your contraception sorted for like 3 to 5 years. So it's just that first bit. Sometimes it can be a bit of a pain, but not everyone. Not everyone has that.
Okay. So what other reasons can the doctor suggest contraceptives for, or are there any other reasons?
Yeah, so the when you're younger, if you're like having heavier periods and PMT and things like that, pills are very good for that. If you also suffer with things like fibroids, heavy periods, so a lot of women, when you've had a baby, your periods change. I know mine did. Like, I used to suffer with heavy periods all the time anyway, but mine totally changed after having children. Became really painful. I've got a lot of PMT symptoms after, which was crazy. Like, my husband would say, oh, you're on your period, you're getting really angry at me, and I'll be like, no, I'm not, and then I'll check and I'll be like, oh, he's right, yeah, I am on my period. But so the coil is really good for that. And actually the Mirena coil, this is not the copper, is actually licensed for heavy periods. It's the #1 treatment for heavy periods. So if you suffer with painful heavy periods, Mirena coil is a really good option for you, and it's licensed for that. Also, on the other end, if you're in your 40s and you're thinking about contraception, Mirena coils can be used as part of HRT. Okay. So if you need it as part of HRT later, it can be used as part of that, and then you just need the estrogen component to it. So that's really useful. So I fit loads of coils in women in their late 40s that actually want it for HRT. I've got a lady actually that I did last week, and she's 56 and she's having a coil change just purely for HRT, and she loves it. So you can have it, you can keep going with it. So yeah, the implant is only used for contraception. There's no other indication for using an implant. It's only licensed for contraception, but the coil, the Mirena coil, can be used for lots of different things.
So are there any myths surrounding coils, implants? I'm sure there is.
Yeah,
Is there any that you can shine a light on?
Yeah, so I mean, yeah, so a lot of people think that the coil is going to make you gain weight, and the implant as well. So a lot of women say, oh, I don't want to go on the implant because my friend went on it and she got really fat and I don't want to go on it. It's actually nothing. There's no evidence to suggest that. It's different to the pill. So if you took the mini pill, the side effects are weight gain and breast tenderness, nausea, because of the progesterone side effects. With the implant and the coil, because they're very lower doses, and the coil especially just acts on the womb, it doesn't get to the rest of your body. So it only acts on your womb. And if it's only acting on your womb, it can't cause weight gain, it can't cause mood swings, it doesn't cause acne. So all of these kind of side effects that people worry about, the coil doesn't do that. It's because of other reasons, or and the main one is that our kids' food and end up eating more calories and their food has got butter in it, and that's why you kind of gain weight. So it's not the pill and the coil or the implant. And I've had women say, I'm convinced it's my implant, I take it out, their weight doesn't change, and then they regret that I removed it. So it doesn't do that. So the only one that can cause weight gain is the POP, the POP pill, which is a progesterone only pill. Right. That's the only one that has actually got evidence to say that it will gain weight. And that's a big one. You know, obviously everyone's trying to shift their baby weight. Yeah. And they worry about that. So that is an important one. The other thing that a lot of people worry about is that it will affect their fertility. So they say, I've heard that if you don't have your periods, then it means I'm not going to be able to get pregnant later on in life. Again, that's a complete myth. Your periods can be delayed in coming back. That one is especially true of the Depo, the injection. But once your periods are back, your fertility will go back to how it would have been pre-contraception. So if someone's on the pill for 20 years, it doesn't matter. As soon as you come off that pill, your fertility is how it should be. So the same for the implant, same for the coil, your fertility will just go back. Bear in mind that, you will be older. So fertility does decrease the older we get. So, whether it will be more to do with that than actually the contraception itself. Other one that a lot of women worry about is the coil causes ectopic pregnancies. I don't know if you've heard that one.
Heard that one, yeah.
So again, that's a myth. It doesn't cause ectopics, but if you do get pregnant with the coil in, which is very rare, it's more likely to be an ectopic. So if somebody is pregnant and they have a coil in, you have to just be wary of that. But it doesn't cause ectopic pregnancies. And then another one that I get commonly told is, which probably won't relate to the ladies listening, is that you can't have a coil if you haven't had children. Again, not true. I fit coils in 18-year-olds and they're amazing. They don't flinch. It's like incredible. And as long as you have a womb, you can have a coil at any age. So sometimes it can be a bit trickier, but any age, and there's no upper age limit either to having a coil fitted. Like I mentioned about the HRT.
Yeah.
And another one that I see a lot when I used to work in the city, where we had a lot of Asian patients, was that there's a bit of a myth about the blood goes somewhere else in the body. So they say it's not natural not to have a period. I used to get this a lot. Where does the blood all go? If I'm not having a period, it's going to stay in my body and it's toxic to my body. The coil, the lining of the womb thins down. So if there's no lining to shed, there's no blood to get rid of. So there's no worry in terms of that your body's not having a period, because there's no blood to get rid of, if that makes sense. So that's a myth as well. And it's fine not to have a period. It doesn't do your body any harm. I think it's nice.
My question. Does it affect you if you don't have periods?
No, not at all. I think it's more of a psychological thing. People worry, if I don't have a period, how do I know I'm not pregnant?
Yeah.
As long as the coil is in and you can feel the strings, it will be working. So but if you are a worrier like that, then maybe the coil isn't a good option, because if your periods stop and you're going to be worried every month if you're pregnant, you're just going to be doing loads of pregnancy tests. So maybe a Kyleena would be better because you'll still have a period every month, or a copper coil may be better because you'll still get that period every month. So it has to be tailored to the type of person that you are and what you require out of your contraception.
No, definitely. Are there any natural methods that mothers can use if they didn't want to go down the whole contraceptive route?
Yeah, so one would be, if it was because you didn't want hormones, then I would say go for the copper coil. If you said, I don't want to use any type of contraception, I don't want anything in my body, I don't want to take any tablets, there are two methods that are known. One is the natural planning method, and that is you keep a diary for about 2 to 3 months, and you're looking for your own body's fertility signs. And the two main things are your body temperature and the cervical mucus, so the kind of your vaginal discharge that you get. It's not an easy thing to do. You have to be really dedicated to do this, because you have to keep a diary. You have to check your temperature first thing in the morning before you do anything, before you get out of bed. And then what you're doing is you're measuring for a rise in your basal temperature, and that's when you know that that happens after ovulation, so you know then you're not going to get pregnant. It also can be affected by things like if you get ill, that would change it. If you're stressed, that would change it. So it's very dependent on your environmental factors. So some women do it. Again, the success rate will depend on how vigilant you are and taking your temperature and things like that. So it's not something I would recommend first line, because the failure rate is quite high, and it's actually quite hard to keep to that kind of strict regime. Yeah. And then the other thing that is the lactational amenorrhea method, people may have read as LAM. So that is purely for women that have had a baby and are exclusively breastfeeding. So they can't give a bottle at all. It has to be exclusively breastfeeding. And they have to be feeding at least every 4 hours during the day and every 6 hours at night. Also not have a period. If you're hitting all those targets and you're not giving any food or anything like that, and you don't have a period, then you're not going to get pregnant. So it's a bit like, when they say, oh, if you're breastfeeding, you can't get pregnant. Yeah, that's true if you follow these steps. As soon as you start weaning, as soon as your period comes, or if you introduce a bottle and you do mixed, you can't rely on the lactational and amenorrhea method. It's purely for that. So normally it's and it's only up to 6 months. After 6 months you can't use it. So some women, do exclusively breastfeed, will not give their child anything until they're 6 months old. It might work for them as long as you don't have a period. So they're two options as well that you can use. So if you want more information about any of the kind of methods, the NHS websites are really good. So if you put in like LARCS NHS, it comes up with all the different options, and it will tell you like the pros and cons of everything. The other thing is every surgery will have a practice nurse that will probably specialize in contraception. Mm-hmm. If you've just had a baby, like I mentioned earlier, at your 8-week check, that should be discussed. And you can always talk to your GP about it. So there's loads of information out there that you can access. And if you're not sure, the best thing to do is speak to a healthcare professional. Don't listen to all the things that people are saying. If somebody's had a bad experience, it doesn't mean that you're going to have that. And actually, whenever I get my ladies coming back saying, oh, this is great, I'm like, tell your friends, because, you hear so many bad things about the implant and the coil, and actually people don't talk about all the good stuff. Yeah, because why would you? No, definitely. Okay, great. It was great chatting to you. Hopefully we'll catch up soon. If you've got any questions, do send them in, and we can get Dr. Rai back in to answer them. But thank you for doing this, and we really appreciate it.